2, 1. Good afternoon. This is Tuesday, December 21st. It's the Public Health and Safety Committee. We do have a quorum with Evans, Gamble, Glover, Johnston, Pulley, Rosenberg, and Taylor. Oh, and Councilman Nash.
Now we got Nash.
Yes. All right. I did make a consent agenda, but before we do that, I do want to hear from Mr. Sharp about a little COVID update, so that way he can share with all of us.
Thank you, Madam Chairman. We've had 2 Omicron cases that we know of, but the sequencing is always way behind the actuality. CDC does about 5% of the cases, and so it's more than that. Where it's taken hold, its percentage of the infections doubles about every 2 days. It'll go from 10% Monday to 20% Wednesday. We're under discussion to open a 3rd testing site if we need to. We've got a place identified, and I think we've got enough money for the tests at this point if we need to do that.
I apologize, I couldn't hear you. You said you've identified another testing site potentially if we need it?
I hadn't decided when to pull the trigger, but they've identified a spot for another testing site if we need that. We think we've got enough money for everything we need to do that. Otherwise, in terms of responses, we're very restricted by the recent state laws of what we can do, if anything. If the cases get up to 7,000 cases a day, we could act, but until then, we really can't do much. Get vaccinated, and get a booster. This is important to know. The 2 doses and the booster will protect you pretty well from Omicron. And so far, again, there's a lot to be learned, but right now it looks like you've got about 70% protection from infection with 2 doses and a booster. Whereas with 2 doses only, that goes down to about 30%. So you're a lot better off with the booster. But in both situations, whether people are boosted or not, the infections, disease symptoms tend to be milder for vaccinated people than non-vaccinated people. We would expect early next year spikes for after Christmas and New Year's, everybody getting together. And once it's here, the way it has behaved at other places, you have most of them, the increase level looks sort of a bell curve-ish like thing. This one looks like a straight up and down line pretty much. I mean, it really takes off when it gets hold. They're concerned about, and we need to think about keeping staffing for the police department, for the fire department, for everybody, because there's going to be a lot of cases at once, almost certainly. So, and the other thing you worry about, of course, is as always, is the hospital capacity. So even though the percentage of cases that end up in the hospital is a smaller percentage, if the absolute number of cases is much greater than the number of people that end up hospitalized, can also go up quite a bit. So far, the indications are it is less serious, but that is based on a relatively small data set. So hopefully that'll prove to be the case. And that's about what I know about that.
Okay, thank you, Mr. Sharp. Does anybody have any questions for Mr. Sharp?
Yes, ma'am.
What is the current daily case rate? Where we are now, you mentioned that if it gets to 7,000 and above, we can add.
It's in the hundreds.
Okay, thank you.
Anyone else?
7,000's a lot.
Yes, it is.
Yes, it is. Anybody else? No? All right, thanks, Mr. Sharp. Okay, so here are what I'd like to do. I'd like to skip over 1263, and these are the ones I'd like to have on consent. So I'll just read the numbers. Let me know if you would like to change anything. 1286, 1287, 1288, 1289, 1296, 1298, and 1299, and then 1300. So really it's every bookend of 2 I'd like to talk about, and then everything else on consent. Does anybody have anything they want to pull off before I start reading?
Move consent.
All right. Second. Thank you. RS 2021-1286, Allen, Evans, and Welsh accepts a grant from the Tennessee Department of Health to the Metro Board of Health to build local capacity to improve public health response to the substance misuse epidemic in the Middle Tennessee High Impact Area, or HIA. RS 2021-1287, Allens, Evans, and others approves Amendment 3 to a grant from the Tennessee Department of Health to the Metro Board of Health to promote the proper use of all recommended vaccines and respond to vaccine preventable diseases in collaboration with the CDC and other partners. RS 2021-1288, Allens, Evans, and Welsh approves Amendment 6 to a contract between the Metro Board of Health and Vanderbilt University acting by and through the School of Medicine to participate as a member site in the CDC Tuberculosis Trials Consortium Studies. RS 2021-1289, Allens, Evans, Bradford, and Stiles accepts a grant from the Friends of Metro Animal Care and Control to the Metro Board of Health to provide funding for a foster program for shelter animals. RS 2021-1296, Allens, Evans, and Stiles accepts the Edward Byrne Memorial Justice Assistance Grant, or JAG, from the United States Department of Justice to the Metro Nashville Police Department to support a broad range of activities to prevent and control crime, including technology upgrades, supplies for direct support, in-service and specialized training. RS 2021-1298, Allen and Evans approves an application for hazardous materials emergency preparedness grant from the Tennessee Emergency Management Agency to the Metro Office of Emergency Management to provide resources to procure items, training, and/or equipment for hazardous materials hazmat preparedness. RS 2021-1299, Allens, Evans, Swara approves an application for an Emergency Management Performance Grant, or EMPG, from the Tennessee Emergency Management Agency to the Metro Office of Emergency Management to subsidize the emergency management program. And then lastly, RS 2021-1300, Allens, Evans, and others approves an application for a Tennessee Safe Courts Grant from the Tennessee Department of Finance and Administration to the Metro Office of Family Safety to update the Gene Crow Advocacy Center to increase storage space and repaint client and child high-traffic areas. Do I have a motion?
So moved.
Second.
Thank you. It's been properly moved and seconded for our consent agenda. All those in favor?
Aye.
Anyone opposed? All right. All right. Good. All right, so we'll move back to the top. RS 2021-1263, Gamble, Johnston, and others appropriates $9,069,614 in American Rescue Plan Act funds from Fund Number 30216 to General Services to expand the vehicle fleet of the Metro Nashville Police Department, the Nashville Department of Transportation, and the Davidson County Sheriff's Office.
Moved.
It's been moved, seconded. It's been properly seconded, so turn it over to Councilwoman Gamble.
Thank you. The ARP committee, well, I'll start over. All of these departments, Nashville Police Department, Transportation, and also DCSO, came and presented before the AR committee about the need for new fleet. They have aging fleet. They don't have enough fleet for all of the officers. Currently, detectives are driving their personal cars. This has been a need that has at least gone on over a year. These same departments came before the ARP or the CARES committee last year asking for fleet replacements, and we were not able to do, well, the committee felt that we needed to focus more on the community response and the emergency response. So the focus was on small business relief, rent and mortgage relief, food relief, and other things. And we did not recommend any of the requests from the departments at that time. This time around, there's more funding available, more time to allocate that funding. We felt that we needed to address this need so that the departments can do their job in a safe and efficient manner. And for those reasons, the ARP is recommending this allocation.
All right, Councilwoman Johnston.
There's been a lot of discussion about what, I don't think anybody disagrees that there is a need. I'm sorry, I'm having trouble talking. I don't think anybody disagrees that we have this need. I think some people are concerned about what funding source this is coming from. So because this is light fleet, this can't be put into any sort of CSP. So it either comes from operating funds, 4% funds, or this gift that the federal government has given us. Operating fund is obviously, we're not going to pass that until 6 months from now, and who knows if we can fit that in there. 4% funds aren't sufficient enough for even for anything else, so that's not an option. Another argument that's been brought up is that it's a one-time source of funds for a recurring need, and the argument against that is that we're in such a hole that we should be allocating money every year in the operating budget to maintain our fleet. That has not happened. We need to get to that point so that we don't get ourselves in this type of a hole again, but we do have to get out of the hole. So it would be a one-time expenditure to help us get out of the hole that we find ourselves in now. So for those reasons, I fully support this allocation. And I hope everyone else does too.
All right, thank you. Any other discussion? Councilman Nash?
I would like Mr. Jameson to kind of make the connection between COVID relief and especially police cars. The connection you mentioned to the Biden letter, I thought was very powerful. Because there was some question about why are we using ARP funds?
Sure. Essentially, it began in July when a memo from the Biden administration with respect to the municipalities were seeking guidance on proper allocations for ARP funds. And the Biden administration did note the apparent connection between COVID and escalating crime rates. When it comes to the police department, and I know this allocates to other departments, but the majority, 128 vehicles of the 142 to the police department. The police department is engaged in a shift change going from 5 8.5-hour days to 4 10.5-hour days. That is ongoing, irrespective of this allocation. That is a specific best practices recommendation from the National Institute of Justice. Benefits police departments in a multitude of ways. But given the Biden administration pronunciation, also the regulations that apply to a shift change vehicle switch, the so-called hot swaps. Now the officer that's hopping out of the car, the next officer on the next shift simply can't jump in. There's a sanitation requirement that applies. And given those regulations, we were seeing sort of a tie-up and shift changes between officers being able to get out onto the street because of the shortage of vehicles. A shortage that we already experienced irrespective of COVID. While we're trying to recruit officers, we have a below ratio rate of vehicles to officers. So these are very much needed. We haven't, I want to underscore, we haven't provided new vehicles to the police department in 3 years. We've provided replacement vehicles to those that have aged out or are damaged, but not a single new vehicle. So this is very much needed. It's very tied to the COVID pandemic, and the regulations that apply to it limit our officers on the streets unless we do this.
And to the point, I haven't had a constituent yet call me and say, I called the police and they got there too fast. It's obvious just the difference. I always have to wait, and this is part of that wait. These cars are badly needed.
Any other discussion? All right. Anybody like to move approval?
Second.
All right. Moved and properly seconded. All those in favor?
Aye.
Anyone opposed?
There's 10 of us in here now.
I don't know. All right, now we'll get to bills on second reading. BL 2021-961, Johnson, Pulley, and others, amends the Metro Code of Laws to pertaining to the use of license plate scanner, LPR technology in the public rights-of-way.
So moved. Second.
All right, it's been moved and seconded. Councilwoman Johnston.
Thank you. In light of the new committee that we have created and its scheduled meeting for January the 5th, I would like to defer to the second meeting in January, please.
Second.
All right. It has been moved and seconded to defer to the second meeting in January. Any discussion? All right, all those in favor?
Aye.
All right, anyone opposed? All right, thank you. Meeting is adjourned.
Back on schedule.
There we go. Moving on.
This is just a